My name is Thijs IJsvogels and I work as a postdoctoral fellow at the Radboud University Nijmegen in the Netherlands, and I also work at the Liverpool John Moores University in Liverpool, United Kingdom. Our review paper entitled Myocardial Fibrosis in Athletes will appear soon in Mayo Clinic Proceedings, and in this video I will summarize our main findings. We performed a systematic literature research to assess the prevalence of myocardial fibrosis in physically active individuals and to identify predictors of potential mechanisms of myocardial fibrosis development and also its clinical publications. And therefore we performed a PubMed and Medline search using MeSH keywords related to exercise and myocardial fibrosis. And we included papers that were published before June 2016. Furthermore, we had 2 inclusion criteria and 1 exclusion criteria. For the inclusion criteria, we included papers that assessed myocardial fibrosis by validated techniques, and the second inclusion criteria was that only populations including athletes were eligible for this review paper. Furthermore, we excluded any study populations that included individuals with underlying genetic cardiovascular diseases such as hypertrophic cardiomyopathy and ARVC. Our literature search identified 307 papers, and after applying the inclusion and exclusion criteria we ended up with 33 records for this review paper. And we could divide them into 2 categories, namely 19 case reports or case series and 14 athletic population studies. Our case reports and case series included 35 athletes, and they ranged in age between 13 to 73 years old. Furthermore, 76% of them was male, and also most of them were pretty young, as 20 out of the 35 cases were younger than 30 years old. The athletic population studies included a total of 509 athletes, of which 30 of them demonstrated evidence of myocardial fibrosis, which is 5.9% of the total study population. Interestingly, 7 studies out of the 14 confirmed the presence of fibrosis, whereas 7 other studies did not find any signs of fibrosis. Also, there was a huge variance in lifetime exercise exposure across athletes and also in age. But we found that athletes with myocardial fibrosis predominantly were involved in long-term endurance exercise. We also assessed the pattern of myocardial fibrosis, as this may provide important information about the underlying causation. And looking at figure 2 of our publication, we can see that a non-specific pattern was the most common pattern observed, followed by an ischemic pattern. Myocarditis was sometimes observed, hypertrophy, mechanical stress, and also in some cases it was not specified. The location of the myocardial fibrosis is summarized in figure 3, and here you can find that there is a lot of variation going on. For the athletic population studies, most cases had fibrosis in the septum or at the RV insertion point, whereas for the case reports this was restricted to the septum or the left ventricle. So to summarize our findings, myocardial fibrosis has been reported in some lifelong endurance athletes. The pattern and the anatomical location of the fibrosis are heterogeneous, which may represent different causation and could contribute to the different outcomes for the case reports and the population studies. The clinical implications of myocardial fibrosis are well described for cardiovascular patients, as the presence of fibrosis is an important risk factor for mortality and other adverse outcomes. However, there's only 1 study that performed a follow-up in athletes with myocardial fibrosis, and they found more adverse cardiac events in athletes with fibrosis compared to their peers without fibrosis. So therefore, athletes with underlying cardiovascular disease should receive pharmacological treatment to reduce the risk of secondary events. The significance of non-specific fibrosis is, however, unknown, and therefore future studies need to address the functional consequences and the cardiovascular risk associated with this type of fibrosis, as this was most commonly observed in athletes.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.